Good morning. My name is Paulette Cha, and I'm a research fellow with the Public Policy Institute of California. Welcome to our virtual program featuring the findings from PPIC's latest policy brief, Pandemic Changes to Medi-Cal and Implications for Immigrant Farmworkers. For today's briefing, I will present the main findings from my brief and then answer any questions that you, audience members, may have. Before we begin our program, there are a few housekeeping items to cover. Today's event is supported with funding from the Sierra Health Foundation. The policy brief and slides from today's briefing can be found on our website at ppic.org. As a public charity, PPIC does not take or support positions on any ballot measure or legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. And finally, if you have a question about the findings, please send an email to the address on the screen, ppiceventquestions@gmail.com. Please include your name and organization along with your question. And with that, let's begin the presentation. So the policy brief I am discussing today focuses on pandemic era changes to Medi-Cal and what they mean for farm workers. Let me set the stage a little. In a previous PPIC report, I found that immigrant farm workers, about half of whom are undocumented, had barriers to care in the pre-pandemic period. Undocumented farm workers were less likely to get healthcare compared to documented farm workers, and this was true whether I was analyzing US-based care or healthcare abroad. Across the board, cost or lack of insurance was the most commonly reported barrier. Documented farm workers benefited from the expansion of Medi-Cal, which is California's Medicaid program, under the Affordable Care Act, and for them, cost and lack of insurance have become less of a barrier. Some age groups of farm workers now have access to Medi-Cal, regardless of immigration status, but most undocumented farm workers are ineligible for Medi-Cal. I'm going to talk a little bit about the changes that occurred during the pandemic to the Medi-Cal program. So in March 2020, the US and California declared public health emergencies due to COVID-19. That month, when the governor issued a stay-at-home order to control the spread of the virus, farm workers continued their essential work outside the home to plant, tend, and harvest crops and keep the food supply moving. During the emergency period, there were a number of Medi-Cal flexibilities introduced that may have impacted farm workers. A little over half of immigrant farm workers have health insurance, and among them, the plurality, around 46%, have Medi-Cal. As I'll get into, Medi-Cal also played a key role for uninsured farm workers during the pandemic. One of the largest Medi-Cal policy changes was continuous enrollment or continuous coverage. The federal government offered states additional funds in exchange for keeping Medicaid enrollees on the program for the entire public health emergency. Regular reviews to confirm ongoing eligibility were paused to ensure that no one lost health insurance in the midst of the pandemic. Not having to fill out and submit paperwork about income and family benefited many enrollees, but may have been especially helpful for immigrant farm workers, about 15% of whom had multiple employers in fiscal year 2020. So pausing the reviews meant that while new people joined Medi-Cal, few left the program. Inevitably, Medi-Cal enrollment numbers grew. As of late last year, the program covered over 15 million Californians, and that's more than a third of the state. The pause is not forever, of course. Another important policy change for farm workers was the pivot to telehealth. Telehealth visits made up only a small fraction of Medi-Cal covered visits prior to March 2020. Because of the pandemic and the recommendations to reduce travel outside the home, the federal government implemented some key flexibilities to incentivize and assist providers in rolling out this mode of delivering healthcare. First, it reduced the requirements on what kind of software could be used for virtual patient visits. If you've heard of HIPAA, the federal law that protects our health data, this is essentially relaxing some of the HIPAA requirements to allow providers to get up and running using readily available platforms such as Zoom or Apple FaceTime. Another really important change was the fact that providers could now get reimbursed for delivering healthcare via telehealth at the same rates as in-person visits. Furthermore, this includes audio-only telehealth, which may be able to extend provider reach to some of the lowest income individuals or to those without fast internet or reliable cell signal. These changes led to a dramatic increase in Medi-Cal covered telehealth visits. Telehealth especially expands access for individuals in rural areas or for those who have work or transportation-related constraints to get to clinics or to doctor's offices. It's therefore likely to have been especially beneficial for farm workers. Even for farm workers who are uninsured, Medi-Cal has played a key role throughout the pandemic. The program ensures that COVID-19 testing, vaccination, and medically necessary treatment for COVID-19 have been covered, regardless of immigration status. Vaccination efforts were very robust at the height of the pandemic, with healthcare providers, community-based organizations, and agricultural employers all coming together to vaccinate and protect farm workers. Long COVID is thankfully less common with COVID-19's Omicron variant, but it is still a concern, especially for older farm workers. Farm workers have been aging, and the average farm worker is over 40 years old now. And farm work is physically demanding work, meaning that even low levels of disability can threaten livelihoods. As you can see in the first or the larger pie graph, I find that about half of immigrant farm workers in California were uninsured in fiscal year 2020, which is a period that includes the beginning of the COVID-19 pandemic. Among the uninsured in the smaller pie graph, you can see that about 80% of the uninsured were undocumented. While the state has been expanding Medi-Cal to various age groups of low-income undocumented immigrants over time, most farm workers who are undocumented are ineligible based on their age. Let me segue now into what's happening later this year and beyond. So first, although Medi-Cal continuous enrollment was implemented as part of the federal public health emergency declaration, this policy change was decoupled from the emergency in last year's congressional spending bill. So the two will sunset on different timelines now. Continuous enrollment will end later this week on March 31st. After that point, it will be possible to be disenrolled from Medi-Cal. The federal emergency ends on May 11th with some consequences that I'll get into shortly. And I should mention that enrollment in Medi-Cal is probably peaking right about now. Of course, when eligibility checks resume, some individuals will be disenrolled from Medi-Cal, and for some, it will be because they no longer qualify. Others, however, will be removed from the program because they can't meet the administrative hurdles or because their contact information on file is out of date. We can definitely expect to see some churn, which is the process in which some still eligible enrollees are dropped and then rejoin Medi-Cal a short time later. Pardon me. Churn is a problem because it leads to gaps in coverage and reduced access to healthcare during those gaps. And finally, the number of California's uninsured will grow as Medi-Cal, which covers more than a third of the state, will begin to shed some enrollees. So the pandemic supercharged the use of telehealth to deliver health services. Policymakers, providers, and patients all wanted to leverage what was learned during the pandemic and keep telehealth as an option going forward. Telehealth is permanently approved for mental health and substance use disorder related health services. And this includes audio-only care, which has the potential to expand behavioral health to Californians across the state. DHCS, which is the department that operates Medi-Cal, has convened experts on using telehealth to increase access and reduce disparities, which led to a component of last year's health budget trailer bill, SB 184. The trailer bill and AB 32, a telehealth bill, are the two recent bills through which the state legislature is allowing certain telehealth flexibilities in Medi-Cal. And they have also authorized related research and evaluation on telehealth in Medi-Cal. Medi-Cal's restricted scope coverage of COVID-19 related health services for undocumented immigrants will be available through the end of May 2023. So that is the end of the month in which the federal public health emergency ends. To be clear, this is the restricted scope version of the program, which has the same name as the comprehensive version of Medi-Cal, which is a little bit confusing. As long as supplies last, tests, masks, and vaccines remain free, And as we leave the public health emergency period, the two largest manufacturers of COVID vaccines pledged to make shots free to uninsured individuals through their patient assistance programs. And finally, some providers, such as community health centers or clinics, are likely to offer COVID-related health services free or on a sliding scale. The period until the 2024 Medi-Cal expansion will be tenuous but short. Despite the patchwork of COVID-related services that will continue to be available, uninsured Californians can fall through the cracks this year. The federal government is still figuring out how to make COVID-related treatments and services like drugs like Paxlovid available to the uninsured. And of course, some undocumented farm workers will be waiting to have non-COVID health needs addressed after comprehensive Medi-Cal is available. Several Medi-Cal expansions to undocumented immigrants by age group have occurred so far in California. Children under age 19 became eligible in 2016. Young adults ages 19 to 26 became eligible in 2020. And adults ages 50 and up became eligible most recently in 2022. Next January, in January 2024, the largest group of undocumented immigrants, those ages 26 to 49, will be able to enroll in Medi-Cal if they meet income eligibility requirements. About 78% of undocumented, uninsured farm workers fall in this age group. And let me close by leaving you with some things to think about as the state prepares for the final expansion of Medi-Cal to all low-income, undocumented immigrants in 2024. Although eligibility is expanding, enrolling uninsured individuals in Medi-Cal will still take work. Outreach about the new policy and hands-on assistance with enrolling will be important parts of connecting uninsured, newly eligible farm workers to Medi-Cal. Of course, farm workers can be ineligible for Medi-Cal due to income. The program's maximum allowed income for adults is capped at 138% of federal poverty. Covered California, the state's healthcare marketplace, is an option for documented immigrants who don't qualify for Medi-Cal, and subsidies are available now for those with incomes up to 600% of the federal poverty level. However, the marketplace is not an option for undocumented immigrants, and we should expect to see some Californians remain uninsured even after the 2024 Medi-Cal expansion. And a final note is that low-income farm workers who have insurance through their employers could switch to Medi-Cal. This is a move known as crowd out. If younger, healthier workers are more likely to switch, crowding out can lead to more expensive insurance for those remaining on those private insurance plans. So there's a lot to think about as we move towards this new policy. So that concludes the presentation. And if you would like to submit a question, please send an email to the address on the screen, ppiceventquestions@gmail.com. So PPIC event questions is all one word, at gmail.com. Okay, there is a question from Matthew in Mountain View. And Matthew from Mountain View asks, farm workers can probably get health care when they go home in between harvests. So why do we worry about Medi-Cal for this group? That's a good question, and I appreciate that you bring that up. Of course, I don't actually talk about where individuals get healthcare in this short policy brief on Medi-Cal policy, but in a previous more in-depth report, I did analyze sort of the settling patterns as well as where farm workers get healthcare. And interestingly, although it was the case in previous decades that undocumented farm workers were more likely to, as you say, go home in between harvests or travel back and forth between their home countries than the United States, that has changed starting around 2010 when undocumented farm workers have converged to similarly low levels of international travel for work as documented farm workers. And so starting around 2010, you see a lot more settling of farm workers in general, where there's less movement internationally in order to come here and work and then go home for periods of respite. And instead, those workers are staying here long-term. They're also more likely to have their spouses with them, and they're also likely to be older. So in a sense, you could think about this as an aging and settling of the farm worker population that's occurred since around 2010. Of course, we found out during the pandemic that those who do not have health insurance or access to, vaccines or treatments are kind of the weak link in our public health, in our population health. And so it does really help our entire community and our state to be able to provide those specific health services to farm workers and all Californians during this pandemic period. But also, I would mention that the expansion that's coming in January 2024 of Medi-Cal to all low-income undocumented immigrants is it's in keeping with the state's Healthy California for All Commission. They are moving towards, or they are setting their North Star as unified financing, but that of course does include universal coverage and access to care. I hope that answers your question. Okay. There is a question from Angela from Sacramento. And Angela asks, Medi-Cal enrollment has soared during the pandemic. Yes, it has. So how low do you think Medi-Cal enrollment will fall after continuous enrollment ends? And will the state budget be affected? Pardon me. I can't say precisely how low the enrollment will come down. Absolutely, we should expect to see individuals being disenrolled from the program. I believe the first disenrollments can occur as early as July 1st. The governor's budget last year estimated that that after a decrease due to disenrollments, that enrollment in Medi-Cal in the next fiscal year would still be around 14.4 million on Medi-Cal, and so still very high numbers. And then those numbers, I believe, were updated by, or were updated by the LAO, who were able to take into account some of the newer announcements by the federal government about the end of continuous enrollment and so on. And that they did come up with pretty similar estimates, a little bit lower enrollment, I think, still over 14 million in the next fiscal year. The changes to Medi-Cal enrollment, so the disenrollments combined with the stepping down of the enhanced federal match that was offered to states in exchange for that continuous enrollment, will have some fiscal repercussions, of course. That enhanced federal match is going to be coming down from 6.2 percentage points. And it's going to step down to 5%, and then 2.5%, and then 1.5%. And then by January 2024, the enhancement is going to be completely gone. We'll be back to regular federal share of Medi-Cal. And the estimated difference estimated by LAO from the governor's budget is around a $1 billion savings for the policy changes that I mentioned, as well as a number of other Medi-Cal related shifts that have occurred. So I would say there is definitely some savings, but the federal government does pay most Medi-Cal costs. And so the savings are a little bit more modest than you might expect. But thanks for your question. Okay. Anicia Lynn Rivas from Homeless Prenatal Program asks, will this affect undocumented families already on Medi-Cal in San Francisco County? I'm not sure if there's anything specific about San Francisco County that I should be taking into account. My understanding is that for individuals who have not been doing recertification or doing those eligibility checks, that is going to restart. I don't know if there's anything specific about San Francisco that I should be thinking about. You mentioned families. I'm just going to say that since California is covering through its state expansions, undocumented immigrants who are low income up to age 26, and as well as those ages 50 and over, if there were young people enrolled in Medi-Cal under that state expansion during the pandemic, and then they turned 26 during the pandemic, essentially aging out of the state expansion population, my understanding from hearing from other advocates is that those young people will, of course, go through recertification, but that will be pushed forward until after the January 2024 expansion. And so as long as they are income eligible, and then they actually do the paperwork, I don't think that the young people will be dropped due to that aging out of the state expansion age group. I don't know if that answers your question. Again, I wasn't really sure about the San Francisco County component that you wanted me to take into account, but thank you for your question. If there's anything you want to say to clarify, feel free to write back. Okay, question from Edward. Will farm workers who are disenrolled due to Medi-Cal unwinding and not yet able to sign up again be covered for Paxlovid treatment now that it is recommended for all, irrespective of age? So, I believe the way to interpret this is if farm workers are uninsured in that period between the end of the federal emergency and the start of the expansion in January, so undocumented farm workers, what is going to be their access to Paxlovid treatment if they catch COVID in the latter part of 2023? If I'm interpreting that question correctly, my understanding is that the federal government is looking into ways to make COVID-19 therapeutics, including Paxlovid, available to the uninsured. I have not heard details about how that's going to happen. That's part of a suite of things that the federal government is saying that they would like to make available to those who are uninsured. And that includes vaccines, treatments, and I'm believing also tests, but my sense is that there will be a way, but I have not seen details yet. Unfortunately, I've also been trying to figure out when that's going to come out. Okay. This question is from Victor from Orange County, and Victor asks, just to clarify, starting January 2024, when Medi-Cal expands, will California have universal health coverage? That's actually a good question because in a sense, yes, and in a sense, no. I would say in general, no, but the largest group of uninsured in California are undocumented immigrants who don't fall into those current age categories of the state expansions of Medi-Cal to undocumenteds. And so bringing in that final largest group of undocumented immigrants who are low income to have Medi-Cal eligibility is really addressing the largest group. I don't think that that is the same as universal coverage because some individuals will fall through the gaps. For example, just looking at the farm worker population, even those who, of those who were uninsured, I mentioned that over 80% were undocumented, but that of course means that about 20% are documented. And so those are individuals who, if they income qualify, can enroll in Medi-Cal. And then there's obviously the group of immigrants, farm workers, and others, pardon me, who have incomes above 138% of federal poverty. Those individuals, if they're not eligible for the exchange, may again fall through the cracks. And for farm workers, they do have, they frequently do have employer insurance. I think in fiscal year 2020, about a third of insured farm workers reported getting their coverage from their employers. Undocumented farm workers are eligible for private coverage through employer insurance. That doesn't necessarily mean that they have access. So they don't necessarily have that on offer, but if it is offered, they are eligible to sign up. So I think I guess in short, I think we're chipping away and we're making a pretty big dent in the uninsured population in California by bringing this final group of undocumented into Medi-Cal eligibility, but I don't think that I would quite call it universal coverage. It's absolutely in the spirit of universal coverage, and I think that the state is getting closer. Really quick, I just want to give the email address one more time. So if you'd like to submit a question, send an email to the address PPIC event questions. That's all one word, PPIC event questions @gmail.com. And please try to include your name and your organization or where you're writing from. Okay. There's a question from Lauren from Bakersfield. And Lauren from Bakersfield asks, are there concerns around health literacy and especially vaccine hesitancy among farm workers? That's a good question, especially as we think about the fact that although these public health emergencies are ending, COVID is still with us. And it does seem like there will be ongoing vaccines for COVID as we move out of this pandemic. So in a previous project, not for this policy brief, but for a previous report on farm workers, I did talk to a clinician who works in the Central Valley with farm workers and treats farm workers as well as non-farm workers. And his take on the amount of outreach and the amount of concentrated efforts by CBOs, by providers in clinics, in community clinics and community health centers, as well as by community health workers, had done an amazing job during COVID-19 to get farm workers on board, to protect them and to get them vaccinated. There were also vaccine drives happening in the fields. And those were vaccine drives organized by employers and by others. But the thing that he reported to me at that time, which was probably about a year ago, that I was surprised by was that he said he did not have a health disparity in terms of vaccine status between farm workers and his other patients. And so I do think that health literacy and vaccine hesitancy are things to continue to do outreach on, but we've shown that it's possible. Organizations have made it happen in the past, and that proof of concept, I think, is really heartening. And then I would say that you mentioned health literacy. Health literacy has come up a number of times for farm workers in the discussions that I had previously with experts. One of the things that I learned was that by including family members, both in the discussions, like literally in the clinics, about treatments as well as about health, there can be kind of like a collaborative form of health literacy. And again, the physician that I spoke with had talked about including family members in treatment plans, whether that's an exercise plan to start with family members or other things such as getting vaccinated as a family. But I think that by kind of expanding who is in the pool of who's in the room and who is included in the discussions about health, we can expand health literacy for farm workers. We are just about out of time. I want to thank you all for your engaged questions. And I want to thank my funder, Sierra Health Foundation, for supporting the policy brief and today's program. And thank all of you for joining us today online. Finally, if you pre-registered for this event, you will receive a survey. We would appreciate your taking a couple of minutes to respond to the survey and let us know how we did. And have a good afternoon.